Good to be back with you on Down the Road. We've got a lot to cover today. I say that pretty much every time. I know that, but we do. We have a lot of things to talk about today. We're going to get a chance to visit about the Delta variant of COVID and what is that doing out there. We're going to actually speak to an Olympian today and going to talk to him about how he sees the Tokyo Games going down. There's been some individuals in the Olympic Village who have tested positive now for COVID. And so what does that mean? What does that mean to the whole Olympic Village? Well, it means testing. It doesn't mean that the Olympics are going to shut down, and there's a lot of people speculating that that could happen. Also going to get a chance to talk about the Fargo Airshow today. The Fargo Airshow, if you haven't been to it, is absolutely amazing. It's something that you should take part in if you have the opportunity to do it. But first, because of that Delta variant and because of what's happening all throughout the United States, we gave Dr. Avish Nagpal, we gave him a call and said we need to talk to him. We need to find out what's going on out there. And there's a lot of people still not vaccinated. They won't get vaccinated. And so we need to talk about that. Dr. Nagpal, good to have you back coming down the road with us.
Hi, Joel.
How do we fix this? I have someone in my life where what he loves the most about his job, the individuals that are in control overall of that job told him you can't take part in it unless you've been vaccinated. You can't go there. You can't be in a press box. You can't do the things that he loves to do. He wouldn't get vaccinated before that. And so, what we're seeing nationwide, let's begin there. I mean, this is busting out again. What does this mean for the general population, even those of us that have been vaccinated?
Yeah, Joel, good points. The trend is actually quite worrying. And, we have been worrying about this for a long time now, what will happen when once the fall comes around. And I think we have our answer even before the fall here. We are already seeing an uptick in cases in multiple states where vaccination rates are lower. And our state, unfortunately, is among those states. We haven't seen what's going on in Arkansas and Missouri yet, but that's a predictor of what's going to happen over the next 2-3 weeks or 4 weeks here in North Dakota.
I'm sorry, Dr. Nagpal, but do you know what the percentage is here in North Dakota?
I don't exactly know that right off the top of my head. I haven't checked the Department of Health website in the last few days. But I can pull it up right here. But what I've been watching here more closely is what's going on in UK, because they have seemed to open up quite a bit even before we did. And even though their vaccination rates are significantly higher than ours, they are still seeing a very high uptick in numbers, approaching that what they saw in fall. Now, the good thing is that they are not seeing any hospitalizations, any significant burden in hospitalizations, but that's entirely because they've had a very good rollout and uptake of the vaccines, which is not the case in our state and multiple other states. And we haven't seen that problem yet. Our COVID census has ticked up a little bit after having a good month or two the last couple of months. But looking at Arkansas and Missouri, I'm actually very worried that we are going to see a significant rise in hospitalizations over the next 1 month here.
So for those individuals, Dr. Nagpal, that say, you know what, I never wanted to take the shot. I never wanted to get vaccinated. I don't believe in it, but I have had COVID. And so if the experts are right and I have had COVID and I now have natural immunities to COVID, should they worry about getting vaccinated?
Yes, they should. Again, this was a matter of a question which was contested for a long time. But what we are seeing is with the Delta variant, which is now the predominant variant, natural infection is not offering as much protection as the vaccination. So it is even more important for those people to get vaccinated now.
So again, going back to the individual in my life who, because of the fact that that he really would lose an important part of his life if he doesn't get vaccinated, that's the only thing that drove him. I mean, he wasn't going to get vaccinated. He didn't believe in the vaccine. I don't know if it was for religious purposes or, reasons, if his minister was saying that to him, or if it was, I'm against the government and everything they do. I just know this now because of the fact that his workplace is saying, look, we can't make you get vaccinated, but we can tell you you're not going to work here if you're vaccinated. Should we be seeing that in all the workplaces?
Yes. I think one word answer to that question is yes. And I've considered it for a long time whether, it is appropriate for me to say that vaccination should be a condition for work or not. And I think I've come to a point in a healthcare setting that it should be a condition to work. I'll talk about healthcare setting because that's what I deal with. Because, we see patients from all walks of life. Some are immunocompromised, some are having cancer treatments. And, the first thing that we say is do no harm to the patient. And a patient comes in our doors and they get COVID in the hospital, that is just not acceptable to us. And we mandate flu vaccine, we mandate MMR vaccines for a reason. And here we have a disease that's much more severe and a vaccine that is a lot more effective than flu. So for me, it's a no-brainer. And we have tried a lot to educate people against the misinformation that's out there, educate them about the risk, but voluntary uptake is only going to take you so much. And we were kind of in a happy place from that standpoint with the original variant where the reproductive number of the virus was 2 to 3. And in those cases, immunizing 70% of your population or workforce may be enough to prevent outbreaks. But now with Delta variant, where the reproductive number of the virus is about 6 to 8, the vaccination requirement for herd immunity goes up with that, up to 90% or greater. And in order to get that kind of a vaccination uptake, it would be very hard to get that done without making it a condition for employment. But then again, these are issues that require some legal expertise, some ethical expertise. But from a purely scientific standpoint, I can say that yes, as an infectious disease doctor, I think it would make scientific sense to have healthcare workers take the vaccine before they come into the hospital or clinic to seek employment. And I think you can extend the argument, same argument to other places too, because how long are we going to go around in circles? You get relaxed, you think it's over, only to realize a few months later it's not over, and we are dealing with a new variant and a new cycle of infections and new lockdowns. That's not worth it anymore at some point in time. Just take a shot and let's get over this.
Well, I'll give you a perfect example of how selfish this can be. Healthcare provider, individual working in the healthcare industry, in this particular case in long-term care, she won't get the shot. She comes down with COVID. She goes to work during that period. She doesn't know probably she had COVID in the beginning. If she did know that she had COVID before coming to work, to me, that's a reason for dismissal. But didn't get the shot. Now she goes back to that facility, and because of the potential of an infection, no one can go. No one can go see their loved one. No one can go at a phase of these individuals' life where it might be one of the last times that you can see them. So it to me, Dr. Nagpal, it's incredibly selfish for them not to be vaccinated.
Yeah, that's a good point. And, that's the other thing that surprises me a little bit. I mean, here we are ready to lay down lives for our freedom and democracy and go to war in places that we have never heard of before. But at the same time, we won't take a shot to preserve the freedom of other people to go around and see their loved ones in a nursing home or in a hospital. I think that's a small sacrifice. Again, vaccine hesitancy is multifactorial. There's not just one thing that makes people hesitant to get the vaccine. As I said, some people don't perceive themselves to be at risk. Some people don't believe the vaccination, and we can educate people and overcome those barriers. But at the same time, we also have to realize that because of our individual preferences, we are putting entire communities at risk, entire states and countries at risk. So, as a citizen, it's kind of our job to think about our fellow neighbors and communities.
Let me give you another example. A North Dakota legislator in Bowman, North Dakota, from that southwest part of the state where the vaccination rate is very, very low, anti-vaccine, a legislator, a leader elected to lead anti-vaccine. He contracts COVID, spends a number of days on a ventilator where they thought he might not make it. He comes out and now he is for the vaccine, and that is Representative Keith Kempenich. Can people like that, will they come out and say it? And when they say it, will it make a difference?
Yeah, it does. And, this human behavior is impacted by individual, experiences. That's how our life stories pan out. And we saw this in fall too. We kept saying that things are going to get worse, and, nothing changed. But when hospitals started overflowing and, there were reports of critical shortages of beds or whatnot, behavior changed. We had mask mandates. People were more cautious going out. People were restricting their activities. And, there are tools to avoid that. Getting a shot, that's all it takes.
Yeah. Dr. Nagpal, consider me on your team. I'm going to keep pushing. I'm going to keep talking to people as much as what I can, and I really appreciate you using your expertise to go out there and push people to vaccine. So thank you, sir. Thanks for coming on.
Thank you, Joe.
When we come back, the Olympics in Tokyo, where do we sit when it comes to COVID? We're going to visit with an Olympian. Someone who understands what it's like to be in that Olympic village. When we come back right here as we go down the road.
Howdy folks, it's a Caroline Cafe. I reckon it's time you're due for a hearty meal. So saddle up for the day with one of our Hey Boston breakfast homemade soups. Fill your grill at our salad bar, sink your teeth into our famous Caroline burger and barbecue ribs. Top it off with spur rattling pie with a calm roll that's sure to put a smile on even the toughest outlaws. Shake the dirt off the boots each night and warm up with the gang. Tell them about it, Stacy.
I can't wait to see you at the county line.
Hi, it's me, Anthony Sullivan. And yes, you've actually caught me at home relaxing because life's been pretty worry-free since I got coverage with American Residential Warranty.
You won't believe what ARW covers. Heating and air conditioning, washers and dryers, kitchen appliances, plumbing, water heaters, electrical systems, flat screens and laptops, even pools and spas, and so much more.
Call American Residential Warranty. They'll get you covered.
1-800-219-1467.
Hi, Hunter Ellis here for Night Hero Binoculars by Atomic Beam. These binoculars let you see anything, even in pitch black darkness. Gotcha.
The secrets are powerful wide-angle atomic beam laser that reveals objects up to 150 yards away, hidden by darkness.
During the day, Night Hero gives you 10 times magnification. And when the sun goes down, press the Night Bright button to see clearly in the dark.
Light up garbage-eating critters or spot thieves before they even get close.
Call or click now and get Night Hero binoculars for just $39.99. Order right now and you can double it. Plus, get our best-selling atomic beam flashlight. Just pay a separate fee. We'll even ship them to you free. This TV special offer is not available on Amazon. You can get it all, but you have to order now.
Call 1-800-619-1091. That's 1-800-619-1091. Or visit bynighthero.com. That's bynighthero.com. Order now.
Attention! Have you or a loved one suffered from maculopathy, a serious retinal injury, after taking the prescription drug Almiron for interstitial cystitis or bladder pain syndrome? In 2018, a researcher at the Emory School of Medicine linked Almiron a prescription drug that treats interstitial cystitis or bladder pain syndrome, to maculopathy, which is sight-threatening and can cause an abrupt change of vision. Call Elmiron Justice for a free legal consultation.
Please call 800-395-5680.
Non-attorney spokesperson. This is a paid advertisement for legal services sponsored by Nightline Legal. Cases assigned on a random basis to participating law firms. This drug remains approved by the FDA. If you or a loved one regularly took Zantac and were later diagnosed with cancer, call right now. You may be entitled to financial compensation. Potential cancers include bladder cancer, colon cancer, kidney cancer, stomach cancer, liver cancer, pancreatic cancer. Do not stop taking a prescribed medication without first consulting with your doctor. Discontinuing a prescribed medication without your doctor's advice can result in injury or death.
Call 1-800-230-9210.
You know, check out his work. He's a seven-time New York Times best-selling author who speaks about the crisis and the competition and everything that goes on with these Tokyo Olympics. He's an Olympian himself. This is a man who in the 1992 Winter Games was a finalist when it comes to speed skating, 135 miles an hour. He obviously is someone who isn't afraid as well. That's Vince Poscente. Vince, good to have you coming down the road with us.
You're welcome. Happy to be part of it.
Before we get to the meat and potatoes, I got to ask you, what's it like to be on skis going 135 miles an hour? I mean, what does it feel like?
You don't forget the feeling. And when it goes well, adrenaline's a funny thing because it isn't until after that you think that he's going on adrenaline. It isn't until after you get that adrenaline surge. It's like, you know, but when it goes sideways, then it's another feeling altogether, which is when you're skiing that fast and it goes wrong, you know the expression, uh-oh. In speed skiing, it's up. It goes sideways.
Did you ever fear for your life? I mean, you hit something at 135 miles an hour, it's going to be a bad day.
Yeah, no. Well, I'm going to say no because that was never part of the equation. It was always, how do I go faster? How do I do this better? It was always focused on peak performance and not what could go wrong. And there's a life lesson there, right?
Yeah.
I've heard a saying, worrying is like praying for what you don't want, you know, so it's just not part of the equation.
I will tell you, as a room raider goes, you know, as somebody who's self-appointed, when it comes to room raider, I think that you score a 10. You know, over your right shoulder and then over your left shoulder. I'm going to guess that those skis over your left shoulder were not something that you used a lot in speed skating.
No, that's my wife. She said, that would look good behind you. I went, yes, dear.
Vince, I want to talk about, you know, what's going on in the 2020 games. You know, a lot of people, this has been delayed. Obviously, everybody's crossed their fingers for these Tokyo games, and yet here we sit. No fans. You know, you've got family who's brokenhearted, who wants to be part of all this. You might be a second cousin, might be a third cousin. It's not going to be there. It's not going to happen.
Yeah.
And so, you know, what's your take on these 2020 Olympics?
Well, I was thinking about our call here, and I wanted to kind of parse it into three segments. There's the athlete experiences three things. First, you know, arriving at the Olympic Games and then leading up to your event. So you got a 2-week window, and at some point there's about a 3-day window where you're going to be competing. And for years leading up to that, when you wake up in the morning, you think about it. When you go to bed, you're thinking about it. I mean, it's daily that this could come true, and then it's coming true. The athletes will experience that still because it's this excitement about the competition. I even remember at the opening ceremonies going, well, this is nice, but this isn't why I'm here. You know, I was here for the competition. So that's the first part. The second part is the actual competition. And you're so hyper-focused on peak performance that I remember we had, I think, close to 50,000 people watching our ski race. And it wasn't until, you know, you kind of come out of it or you're skiing down the mountain and you hear this crowd noise and you go, wow, that's a first. I mean, you notice it, but it's not a distraction of sorts. We have a local wrestler here in Dallas who was kind of glad there wouldn't be fans because his competition was a guy from Japan. So he was kind of happy about that. And then the third piece, and this is the travesty part of it, just for an athlete, is once the games are over, you got the athletes' village, which whatever stories you've heard. Yeah, I mean, there's finely tuned specimens. They're all about the same age. They're at the peak of their physical condition, and they're, undeniably attractive because you look over and go, mother of God, that's a beautiful person, And so, you have the cafeteria, you're mingling with all the other athletes. You've got sometimes there's discos on site, there's movie theaters. I mean, there's all sorts of things to do in your recreational time. And you're just bonding with people from other countries, some friendships that will last a lifetime. And that's the travesty part of this is it's not going to be the case. I mean, there'll be like a college dorm kind of sneaking around trying to, have fun. But, and I will wrap this. My favorite part of competing in the Olympics was sharing it with family and having family there. And that's taken away too. COVID, I think it's the Latin word for your plans just changed, right? So here we go. The athletes will fulfill the dream of getting to and competing in and maybe taking home a medal. And then we'll be cheated out of that corollary experience of people there and the excitement. I mean, even wandering around the Olympic town is some fond memories that I've had, is just going into town and there's tourists from all over the place and they're wearing their country's colors, and you meet no strangers at an Olympic Games ever.
I want to ask you this, because I'm going to take you back to 1992. You mentioned you're at the peak of your physical ability, and you're as healthy as you can possibly get. You've trained, you're ready. Would you then, and I'm not sure you know the answer to this, but would you then, knowing how healthy you were and how young you were, would you then be concerned about COVID?
No. It would be kind of checklist of things to make sure that you can perform at the highest level. So if it was going to impact me personally at that time, I mean, some of these athletes cheat because they go, well, this will help, this will help me get better. They don't think down the road. There's the consequences beyond this 2 weeks, in August. They're not thinking about August at all. They're thinking about, this dream come true of being in the Olympic Games and representing their country and their families and that 2-year run-up, or 4-year run-up. So I would have to say that a lot of these athletes, I've got 3 college-age kids, and they're aware of COVID, but they're partying like rock stars. They just don't, they don't really see the consequence piece.
Yeah. So I want to look at it from the perspective of you and your wife. If you were going to today, if one of those 3 college-age kids were in the Olympics, would you be concerned if you two hopped on a plane, went to Japan, and were in that melting pot of all of these countries?
Yeah, I would. I definitely would. I mean, I'm vaccinated, and I believe in science. But the idea behind having getting in an environment where you could get sick, I don't know. I would. That's a good question. I think I would go to Tokyo if they allowed us to. Yeah.
Yeah. Well, here to me is what's going on. That is. I'll give you an example, and I used this earlier in the show, Vince. I have a brother-in-law that's in long-term care right now, struggling with Alzheimer's, and I can't go see him because one of the workers at the place that he's at wouldn't get vaccinated. She came in with COVID. Here we sit. We're being barred from going into the facility. So do you think that those individuals that are going to the Olympic Village that haven't been vaccinated, do you think they're being selfish?
Yeah.
Mm-hmm. Okay.
Yeah, I think it boils down to that one word, selfish. I mean, and we're being more and more oriented to be selfish. If you look at trends with social media, it's a one-way communication about what a person thinks. That's a one-way communication with no consequence, seemingly, of just self-orientation. So, yeah, the psychology of being self-absorbed, and we've seen it. This isn't new. I mean, you remember back in the day when we went to shopping malls, there would be people that would get to the bottom of an escalator and stop and think, it's like, seriously, Anyway, so yeah, it's the human condition. But I think when people are informed and they attach a consequence to it, then they make the decision. My mom always said when she wanted my dad to wanted our family to do something, she would make it his idea. So when it's their idea, then it's a good idea.
That's what I do at work. I manage a number of people, and I'll say, the second floor, which is corporate management, they need us to do this. Well, sometimes that isn't always true. So Vince, 7-time best-selling author on the New York Times best-selling list. Your work, I mean, I could make you rattle off all 7, but the truth of the matter is the Google's going to get you there. Is it all about Olympics competition? I mean, that body of work, what is it about?
Yeah, great question. They all thematically are, why do we do what we do, and how can we do it better? So I wrote a book called The Ant and the Elephant, for example. And it's a parable about an ant on the back of the elephant realizing he's not going to get to the oasis unless he figures out how to get the elephant there too. It is actually based on science where a Dr. Lee Poulos found in a second of time your conscious mind uses 2,000 neurons, while your subconscious mind is using 4 billion neurons. And the ratio of the conscious and subconscious mind's activity is the same ratio between an ant and an elephant. So basically, as an author, what I do is I'll take a concept and I'll go, well, what if you take the ant and the elephant and then all these life challenges come? What if we do this, human nature. We say we go on a diet, right? On the back of the elephant. So we start marching west towards that diet. But what if the elephant is headed east? Then we walk by the mirror getting out of the shower going, yeah, this isn't working. So, the ant and the elephant is just an example. I wrote a book called The Age of Speed. That was the New York Times bestseller of 2008. And we live in a world going so fast, but we personally don't want our lives to go faster. We just want everything to happen faster for us, not necessarily go faster or have more chaos. So you take a concept, you run with it, and then hopefully it resonates with the readers.
Well, you talk about speed, you talk about your reference of your last, I shouldn't say your last book, but one of your books. And I can tell you this, speed. Speed is, whether your mind can keep up to it, whether or not you believe in it. When I officiated college football, I started at one level, Division III, Division II, went up to Division I, and people always ask me what the difference was. And the truth of the matter is there was 300-pound guys at every one of those levels. But at the top level, they were way faster. And so you're right, whether or not you could keep up to it was the difference of whether or not you'd make it. Promise me we can do this again, Vince. This has been a blast, okay?
Yeah, anytime. Yeah, this is, we're here to make the campsite better than we found it. So good job for you as well.
Appreciate it. When we come back, ladies and gentlemen, Dick Walstad, longtime organizer, longtime committee member when it comes to the Fargo Airshow. Let's talk to him about what's going to be blasting through the air when we come back right here down the road.
Hey everybody, I'm Doug Billings, your host of The Right Side with Doug Billings on Beck News. We bring you high-profile guests, ladies and gentlemen, exclusive guests. Now, you're not going to see these guests in most of the mainstream media outlets. Another thing that I do here is give guests a platform to speak freely. You're not going to see me censor anybody. Please join us, won't you? Weeknights right here on Beck TV and online at beck.news. Cheers.
Hello, I'm Mike Lindell, and as you know, my passion is to help each and every one of you get the best sleep of your life. That's why I created my new Giza Dreams bed sheets. The first night you sleep on my sheets, you'll never want to sleep on anything else.
Go to MyPillow.com or call the number on your screen right now to get your very own MyPillow Giza Dream sheets. When you buy one set of sheets, you'll get another set absolutely free.
For the best night's sleep in the whole wide world, visit MyPillow.com. Introducing the Cool Turtle, the ultra-comfortable mask enhancer that creates a protective, cool, and breathable space between your mask and your face. Simply slide under any mask or gaiter and immediately feel the refreshing pocket of air surrounding your face. Cool Turtle's ergonomically designed, soft, comfortable shell immediately reduces mask friction, allowing you to breathe and talk in a comfortable environment.
I can actually breathe. With the Cool Turtle, no more sweating.
It's like I don't even have a mask on.
Call now and get not one, not two, but 3 Cool Turtles for just $10. Order now and we'll send you 2 more Cool Turtles free. No fees, absolutely free. Plus, you can get a 10-pack of 4-ply face masks. Just pay a separate fee. This offer is not available on Amazon. Get the real Cool Turtle now.
Call 1-800-270-1219. That's 1-800-270-1219. Or visit getcoolturtle.com. Order now.
Seniors, are you aware that you could pay less for your car insurance?
Seniors can save money on their car insurance.
You might save a little, you might save a lot.
Maybe hundreds of dollars a year.
You might save 5% a year, maybe 10%, 15%, or even more.
That's a lot of money. So call right now and find out just how much money you might be able to save.
1-800-699-0761. 1-800-699-0761.
Calling all first responders. Join us Friday, July 30th for First Responders Night at the Bismarck Event Center. The Bucks take on the Green Bay Blizzard with a 6:05 p.m. kickoff. For more information on tickets, please visit bismarckbucks.com.
It doesn't matter what age you are. I'll tell you what, the Fargo Airshow is one of those events where you think about taking the grandkids to, because you're going to talk about it. You're going to have that memory for the rest of your life. That's how great it is. Been there, done that. I've actually been in awe of what some of these pilots can do and what some of these airplanes can do. Dick Walstad has been an organizer of the Fargo Airshow for a long time. He believes in it, and they deliver the goods. And he joins us right now. Dick, good to have you going down the road with us.
Hey, Joel, good to be with you. Thanks for having us on.
Okay, talk to me about this. If people turn out, where do they go? What do they do?
Well, I'll tell you, this is going to be one fantastic air show. I mean, this is going to be one of the better ones in the whole country. We have an absolute first in the country, first in the world, I believe, event to see out there. But of course, the headliner is the Blue Angels. And Kurt Kesselring, Fargo South grad, Concordia grad, is now the commander of the Blue Angels, the boss as they call him. This is a really big deal. We had one previous boss from North Dakota named Gil Rude.
I remember.
From Mayville, North Dakota. Actually, he likes to say from Portland. And
well, there is a major difference.
Well, there is. I said suburb, no way.
It's like saying Fargo, West Fargo.
There you go, yep. And so Gil was the boss of the Blue Angels in '86. And in the audience was a young kid, 6-year-old, watching that show, and commented to his dad, I want to do that. His name is Brian Kesselring, and now he is doing that. So he'll be here with the Blue Angels 2 days from now. They're going to hit town Wednesday, and you and everybody else in Fargo is going to know it.
Yeah.
They are loud. But we are in for a real treat with the Blue Angels.
How do you get that?
Well,
I mean, that isn't easy to get the Blue Angels to come to your
absolutely
airshow.
not. There's tremendous competition. They stack up about 200 applications, and then they start picking out their favorites. I got in on the selection process through the back door one time and found out how they do it. But they pick out their favorites, and they do about 30 shows over the course of the year. So there's 150 applications do not get the show. So they like what we've done here. Of course, Gil Rude flew here in '86, and that kind of kicked the door open. And then we got the Blue Angels back here in early '90s and kind of hooked up with them. We've become kind of their favorite place.
Really?
We take real good care of them when they're here. We do a lot of fun things in past years. We've taken them fishing, gulting, trap shooting, and a whole lot of other things. So that kind of helps grease the skids a little bit. But We do run a really, really good show. Our people know what to do. And back when the hooligans were flying F-16s, of course, you had that network out there supporting these things. The hooligans are still there doing that, not flying F-16s anymore. But we run a very good show. In 2009, the Blue Angels picked Fargo as the show of the year. Of all the shows they did, they picked us as the best because we run a real tight ship and do a real good job.
Well, I interrupted you when you were going to go down the list farther. So do that. It isn't the Blue Angels, even though that's the headliner.
Oh, the Blue Angels, the headline. I will tell you, we have the F-16 demo team. That's a U.S. Air Force demonstration team. That is going to be a phenomenal thing to see what they do with an F-16. The one that is going to be an absolute, don't miss it, is when we put the twin Yak and the Jet Waco in there at the same time. Now, a Yak is a Russian aerobatic plane. A guy named Jeff Bourbon took two of those, merged them together. They got two fuselages, one wing, two engines up front with propellers, and he hung a jet engine underneath it. He was at our last show, and people are just in awe. They look up and say, oh, my God. And so Jeff wanted to come back here, but the Lindemans out of Valley City came into ownership of a plane called a Waco, 1939 vintage biplane. That has a prop engine in it, and they added a jet engine on that. So those two planes have separately flown shows before, both of them been in our show. But first time in the world, they are going to fly a dual show. They will each be doing a solo act as well as a dual act. It has never been seen before. And I watched a demonstration of it a few weeks back, and it was just, the word awesome is overused, but this is double awesome if that's the case. They are just something to see. You absolutely don't want to miss that.
Well, the Lindemans, I'm going to spend some time with them on Thursday.
Oh, wonderful.
Yeah, they've got a big event going on at the airport in Valley City.
There you go.
So
yes.
We're going to take the cruiser there, and I'm going to spend some time on radio there.
Great.
And, you know, these guys they have such national recognition that, you know, they have a number of, well, they're going to be making movies. I don't think that it's any big secret. And so
yes.
These guys are skilled.
Oh, they're very talented young men and aggressive young. They are really after things nationally. I'm not talking just over here in our country. They'll fly to the big show at Oshkosh following our show, and then they're going on the air show circuit with some of these things we're doing here. So, yeah, they are amazing kids.
Yeah. I want to talk a little bit about, you know, how this works. 70 volunteers, the board that you're on, the committee that you're on. You know, this isn't exactly something that Dick Walstad gets rich doing. This is just something that you know you can do to help Fargo.
Well, absolutely. We, you know, kind of started this thing by chance back in 1989. A guy named Vince Lindstrom announced we were doing an air show, and Daryl Schrader and I were running it. We called each other and then called Vince, what's this all about? Well, we talked about air show over a beer one time, and I figured we'll just have you guys do one. So
and he put you in a box.
That's how it started. And we got the Thunderbirds, and we got Chuck Yeager to come that time. So that was good. And darn, we got through, and we had some money left over. Well, we did another one, had some money left over, and we got around to, one day I said to Daryl, what are we going to do with this extra money? We gave a lot of it away. We never got paid. Yeah. And so Daryl said,
I want to stress this. You never got paid. And
never
this
got
is
paid.
A lot.
Never
this
got
is
paid.
a lot of work.
Well, pardon me. I need to correct that just a little bit. Everybody in our committee, all 70, get 2 free tickets.
Oh, wow.
After that, we buy them. I personally have bought over $1,000 worth of tickets myself because my whole family's coming to town this year. So anyway, and everybody same on the committee, if we make some money when the show's over, pay our bills. By the way, bills for this show are about $750,000 to run it. If we have some money left over, we give it away. And so we put a lot of money in the Roger Maris Cancer Center years ago, the YMCA, the New Sanford Hospital. And the first dollars at the Fargo Air Museum came from the Fargo Airsho Committee. And so we started there, and we do it again. So we're going to do that again this year. If we make some money, we will be putting some more money in the Fargo Air Museum. But we also have about 30, 40 other organizations we've donated money to. In addition, when groups help, we need 400 people on the deck on show day. And so we get a lot of organizations, Boy Scouts, church groups, soccer clubs, hockey players, all kinds of things, come in and help us for the day, and we'll pay each of your people $50 a day. We'll give it to your organization, and if we make money, we'll pay a bonus besides. Sweet way to do a fundraiser, and and I think there's still some help slots open.
Okay.
So if you want to get involved, go to the Fargo website, fargoairshow.com. Amazing video on that website with a welcome by the number 8 of the Blue Angel team, and come on out and help. But let me go a couple of the things that we have at the show. We have Kent Peach out of Minot does a comedy routine with he's a neat guy, and we'll do a comedy routine, and it's something called a dead stick. He'll get up in the air, shut his engine off, and finish his routine and taxi right up to the announcer stand. The U.S. Navy leapfrog parachute team will open the show, and by the way, they will open the show with a unannounced guest jumping with them. Might surprise people who it is. Can't tell you, I got to kill you if I do that. But anyway, there's going to be, they will open the show. There'll be 10 of the Navy SEALs with a giant American flag. And then we'll have, following that, we'll have a bomb run with a B-25, a World War II bomber, going to blow up the end of the runway. And then we got a 300-mile-an-hour jet-powered truck.
I've heard
36,000 horsepower. I mean, when you hit go on that thing, it's amazing. He is going to race an airplane. And I'll tell you in advance, he will beat the airplane. Amazing. We've been trying to get this guy here for 20 years. He's going to be, Thursday afternoon, he'll be on display over at the Petro Shopping Center.
Okay.
Be on display there.
So you can see it.
You can see it.
Take a picture of it.
Yes, sir. And you walk up and touch it and talk to the guys that drive it.
I only have a little bit left. I want to make sure people know how much the ticket is, where to go.
About $25. You can get them online, and if you want to get premium seating with food and beverage and reserve seating, go online and upgrade to that. Don't miss the displays we'll have on the field. Some things coming in.
So don't just sit there and hide out in the off grounds.
Come on inside and watch the show. Food and beverage are available in there. Bring a blanket, bring a bag chair, and there's plenty of food and beverage, but there are some tremendous displays on the grounds. Red Tail has got a display that's sitting out there by the Air Museum right now. We'll set it up for the show. But a lot of things to get involved with. And if the kids get a little bit restless, shucks, we're going to have games galore there, too. They can get over there and bounce off a little energy and so on. So tremendous show coming up. Golly, don't miss it if you get a chance.
Website one more time.
FargoAirshow.com, and there's a great display on there of the Blue Angels and the other people that are flying on the show, and you can hook up and buy tickets right there.
Dick, thank you.
Thanks
for doing this.
Joel, I'm glad to, and good for Fargo Moorhead and good for the whole area.
Exactly. Folks, when we come back, some comments for you. We'll talk a little bit about COVID when we come back here down the road.
Hello, I'm Mike Lindell, and as you know, my passion is to help each and every one of you get the best sleep of your life. That's why I created my new Giza Dreams bed sheets. I started by using the world's best cotton called Giza. It's only grown in a region between the Sahara Desert, the Mediterranean Sea, and the Nile River. It's ultra soft and breathable, but extremely durable. My Giza sheets also include full 21-inch wide pillowcases that will fit over any pillow and deep pocket sheets that will fit over any mattress. The first night you sleep on my sheets, you'll never want to sleep on anything else.
Go to mypillow.com or call the number on your screen right now to get your very own MyPillow Giza Dream Sheets. Giza Dream Sheets are available in a variety of colors. Use your promo code, and for a limited time, when you buy one set of sheets, you'll get another set absolutely free.
For the best night's sleep in the whole wide world, visit mypillow.com.
Non-attorney spokesperson. This is a paid advertisement for legal services sponsored by Nightline Legal. Cases assigned on a random basis to participating law firms. This drug remains approved by the FDA. If you or a loved one regularly took Zantac and were later diagnosed with cancer, call right now. You may be entitled to financial compensation. Potential cancers include bladder cancer, colon cancer, kidney cancer, stomach cancer, liver cancer, pancreatic cancer. Do not stop taking a prescribed medication without first consulting with your doctor. Discontinuing a prescribed medication without your doctor's advice can result in injury or death.
Call 1-800-230-9210.
Seniors, are you aware that you could pay less for your car insurance?
Seniors can save money on their car insurance.
You might save a little, you might save a lot.
Maybe hundreds of dollars a year.
You might save 5% a year, maybe 10%, 15%, or even more.
That's a lot of money.
So call right now and find out just how much money you might be able to save.
1-800-699-0761. 1-800-699-0761.
Hi, it's me, Anthony Sullivan. And yes, you've actually caught me at home relaxing because life's been pretty worry-free since I got coverage with American Residential Warranty.
You won't believe what ARW covers. Heating and air conditioning, washers and dryers, kitchen appliances, plumbing, water heaters, electrical systems, flat screens and laptops, even pools and spas, and so much more.
Call American Residential Warranty. They'll get you covered.
1-800-219-1467.
Go for Launch 2018 series winner. Without further ado, it is my honors. Regina. The winning team is the Flumin River Excellent.
Oh my God!
They won!
Let me tell you who I don't have a lot of sympathy for. I don't have a lot of sympathy for those individuals who aren't and don't get the freedom to do whatever they want with their life because they haven't been vaccinated. There are individuals out there that now are sitting there and they don't have the vaccination card. Let's call it that. And because of that, they're sitting there going, well, they can't stop me from going here. They can't stop me from going there. Yes, they can. And yes, they should when it comes to some of these events. You don't want to get vaccinated, that's fine. Go ahead and spread it amongst those who don't want to get vaccinated. I get it. I understand it. Actually, that's not true. I don't understand it. I don't understand it one bit because my guess is you had your polio shot. But that being said, now I'm hearing some of these individuals complain. Oh, they won't let me here. They won't let me there. I can't do this. Hey, my job makes me do that. Tough. Tough. If you don't want to get vaccinated, there are places you won't and shouldn't be able to go. You should have some separation. I don't believe that teachers that don't want to get vaccinated should be allowed to teach. I don't. I don't think that coworkers should be in a closed environment that don't want to get vaccinated along with others. I don't. And for those of you who are sitting there saying, well, what do you care? If you've been vaccinated, Heitkamp, why do you care whether or not I've been vaccinated? Because not everything is known. What's known is if you get certain vaccines, you're in the 90th percentile for not getting COVID. What's known is it's spreading again. The numbers are going up again. The new Delta variant is causing individuals to get sick. When you have a state legislator from Bowman, North Dakota, in Keith Kempenich, and he's made this public. It was in an article in the Bismarck Tribune, so I'm not abusing his privacy by saying this, but he was an anti-vaxxer. He was. He was one of those, why do we have to wear a mask during the legislature? He was. Not just the individual who was just embarrassing to all North Dakota from Minot, or not Minot, he was from Northwood, walking around with a Crown Royal bag on his face. What a proud moment that must be for the folks from Northwood and that district. But Keith Kempenich from Bowman had that attitude that much of the people in Western North Dakota had, which is, I don't have to get vaccinated. It's no different than the flu. Well, you tell me how many people that have had the flu are on a ventilator for 10 to 15 days. You tell me how many people that have had the flu have a lot of family members on bended knee praying that that individual stays alive. It's worse than the flu. It has, for many people, long-lasting issues that it brings to them. Obviously, I had COVID. I never hid that here, but I've been vaccinated. How I contracted COVID, I don't know. I don't, just like many people. I don't know where I got COVID. What I do know is this. I do know that once that vaccine became available, And they were going through that process of when you would qualify. I wanted it. I'm 59 years old, so I had to wait my turn. There were a lot of people before me that were being vaccinated, but by God, once I could get it, I went and got it. Keith Kempenich didn't. And now Representative Kempenich is going out and he is telling people to get vaccinated. What is that? That's leadership. He easily could have just hid the fact that he hadn't been vaccinated. He could have easily hid the fact and said, in the area of privacy, you don't need to know whether I've been vaccinated. It's none of your business whether I've been vaccinated. He could have done that. Instead, Representative Kempenich is doing what I think is the good thing, which is to go out there and say, I was wrong. How many of you will do that? How many of you will sit there and say, you know what? I was wrong. Somebody in my family contracted COVID, this new Delta variant, and it's an issue. We lost individuals. Well, in Representative Kempenich's case, he provided leadership. He did. Senator Kevin Cramer still won't say whether or not he's been vaccinated. He won't. He won't say whether he supports other people being vaccinated. It makes him popular with a former president, but I tell you what, for anybody out there at risk, for anybody out there who's trying to keep that family member alive, for any one of the Kempenich family that was praying to God that Keith stay alive, he isn't doing them any favors. He isn't providing leadership to them. I'll be back with some more right here as we go down the road.
Do you worry about going to the dentist? After all, a visit to the dentist can easily cost $2,000 or more. Well, relax. The Carefree Dental Card is now available in your area. Call now and we'll send your actual card at no cost today. With the Carefree Dental Card, you go to the dentist whenever you need and you instantly pay a lot less. Activate your card and you can start using it immediately. From exams and cleanings to more expensive procedures like crowns, dentures, even braces, they're all included with the Carefree Dental Card. Say you go to the dentist today without any card and your bill is, well, ouch. Wait a minute, let's try that again. You go to the dentist today and show your Carefree Dental Card, you save $525. The Carefree Dental Card is just $15.95 a month, so call now and make going to the dentist carefree.
Call 1-800-416-5739 to receive your Carefree Dental Card information kit. 1-800-416-5739. Call now.
I can't say enough good things about these nano hearing aids.
Real people talking about nano hearing aids.
The hearing quality is great.
Until now, hearing aids used to be too expensive for the average person. Until nano. Call now and you'll get your nano hearing aids for only $297. You'll save $100. When you buy one hearing aid, Nano will give you a second hearing aid free. Call right now.
1-800-213-3815.
Spas, etc.
You've come to know and trust us for over 18 years with the largest selection and showroom in Western North Dakota for our beautiful Sundance spas. Plus, you could pick out your next home experience with our selection of pool tables, shuffleboards, and fun accessories.
Spas, etc. Your relaxation destination on Main and Bismarck.
Calling all first responders. Join us Friday, July 30th for First Responders Night at the Bismarck Event Center. The Bucks take on the Green Bay Blizzard with a 6:05 p.m. kickoff and will highlight those who serve and protect our communities. For more information on tickets, please visit bismarckbucks.com. Get your free general admission tickets today.
Attention! Have you or a loved one suffered from maculopathy, a serious retinal injury, after taking the prescription drug Elmiron for interstitial cystitis or bladder pain syndrome? In 2018, a researcher at the Emory School of Medicine linked Elmiron, a prescription drug that treats interstitial cystitis or bladder pain syndrome, to maculopathy, which is sight-threatening and can cause an abrupt change of vision. Call Elmiron Justice for a free legal consultation.
Please call 800-395-5680.
You know, today on my radio show, I had an opportunity to speak to higher ed officials and private businesses about jobs and about filling those jobs, about whether or not higher education is meeting the demands that the public has of certain trades. I mean, we can mention them, right? Electricians, plumbers, diesel mechanics, nurses, nursing assistants, all of those things that higher ed can make sure people are certified to do. You know, that being said, is higher ed getting the job done? It depends on who goes into those programs, right? It depends on how much access they get to the classroom to recruit people into those programs. It depends on parents. It depends on whether or not parents look at little Johnny and they say, Johnny, you're a C student at best, and you don't belong at the University of North Dakota or at NDSU. It isn't about hockey, and it isn't about football. It's about whether or not you graduate in a field where you can go ahead and have that fishing boat, where you can go ahead and have the lifestyle where any given day you can say, you know what, this year I'm going elk hunting. I don't know what it is that's going to drive you. What I do know is this, that there are many of those trades that are going to provide you the type of life where you're going to be smiling when you head down the road in that new pickup. So those are pretty good days, and they're going to happen sooner rather than later for you. I didn't have that when I was young. I didn't get paid what people could get paid now as a percentage of income versus expenses. So it's there. It's there. When it comes to higher ed, could they do a better job of partnering with private business? Sure. Could they get freed up to do a better job? Yes, but that would take more activity from those individuals that oversee it. We shouldn't be in one bit grading higher education by, I've got 2,000 students, so I'm better than if I had 1,500. We should be judging them on whether or not these young men and women graduate. We should be judging them on whether or not we've helped, and I stress the word helped, to put them into the right program, where they've had the courage to look at them. And don't forget this. It's about that guidance counselor in high school too. And don't forget this. It's about job shadowing. So remember that as well. It's always fun going down the road with you folks.